So, do GI doctors get scoped? Find out on this next podcast of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. And if I don't sound as energetic as I typically do, it's because I've been prepping all day for a colonoscopy.
Oh, the joy.
Yes, of course GI docs get scoped.
Heaven forbid.
Heaven forbid. Even though I do have some GI colleagues who refuse to get scoped.
Really?
Yeah, and I'm just like,
that's their
why?
livelihood.
Yeah.
They understand the importance of it. Why wouldn't they do it?
Don't become a victim of the disease that you try to prevent in all your patients, colon cancer. So anyways, but yes, we do get scoped. I did have a colonoscopy 5 years ago. I had a little tiny polyp, and so it's time.
That's because it was your 50th birthday.
That's right.
So because you had one tiny polyp, they said 5 years, right?
Right.
So here we are back again.
That's right. Plus I have family history of colon polyps, so considered a risk factor. It's in my mom. And so yes, it's 5 years. It's crazy how fast the time has gone.
It is, because it feels like it was just yesterday you had that done.
Yeah. Well, it does feel like it was yesterday. Yes. And so, and now and we did a podcast about this not too long ago. Now the age for starting colonoscopy is age 45.
Yeah, not happening.
That's right. Age 45. So
I'm waiting till 50 because I'm healthy. Yes.
Yes. So
anyway.
Yes. Anyways. So yes, I am prepping for colonoscopy. I'm actually going to have a colonoscopy and an upper endoscopy. If you've been with us on this journey since January, you know that I have these enlarged lymph nodes. Even though on this last scan I had a few weeks ago, it actually shows no progression, which is really awesome. Hallelujah. I'm very thankful and grateful for that. But I have to stay the course. And, and so part of it also was, number one, I knew I was due for my colonoscopy this year, but I'm also having an upper endoscopy just to take a peek in the stomach and esophagus, make sure that everything looks okay. And so yes, that's coming up here now on Wednesday.
Yes, 2 days away. So what have you been doing all weekend?
So I basically went on a very low fiber diet, low residue. So like not a lot of grains, not a lot of, low fiber. Tina made me some mashed potatoes, but no peels. No peels. And, I haven't been eating my green salads like I typically do because that's just an amazing amount of fiber that will be a little more challenging to flush out. So basically you're kind of like on a
really bad diet.
Yeah, kind of on a bad diet. So, but I've been just, watching my diet, low fiber over the last few days, and just really hydrating well. And last night I did a bottle of magnesium citrate just to get things moving. And
then you scoped today?
Yeah. Well, here's the thing.
Did you start pooping last night or today?
My wife doesn't know what happened to me last night.
I did not know.
She has no idea.
Yeah.
So I drank it last night at around 6:30. Okay. Now, it can kick in anywhere from half an hour to 6-7 hours. I've taken this before because I took the magnesium citrate when I had my last colonoscopy, and it didn't kick in for like 7 to 8 hours. So I knew that was probably going to be the case again. So sure enough, at about midnight, I all of a sudden jumped out of bed.
Is that why we were low on toilet paper this morning?
Possibly.
Okay.
Possibly. And I made myself, I worked my way through all the bathrooms. I left our room because I didn't want to wake Tina up. And I went downstairs And then I thought I was done, and I came and laid down. And when I laid on my belly, that was not good. And so it just continued and continued. And by 3:30, I was so wide awake, I couldn't even sleep.
Wow.
So I actually got up and started doing work at that time. And I just continued. The magnesium citrate continued to have its way with me till about 5:30ish or so. And then
was stool still coming out
yes,
at that point?
Yes.
Wow, and that's crazy because you've been doing your coffee enemas every morning.
Yes. Yes.
There's a lot of poop in there.
Exactly. So yeah, it's pretty amazing. So I decided that today I was going to just stick to liquid diet. I mean, typically the clear liquids isn't until the day before the procedure. Okay. But I decided that I was going to start it today. I mean, come on. I'm a gastroenterologist. I need to have a pristine, clean colon.
Last time she had her colonoscopy, the doctor, who's our friend, he came in and he's like, did she do like 2 preps? I was like, yeah, she actually did 2 preps and like ate so crazy low fat diet for like 2 weeks before the procedure. Like it was just insane, the prep she did last time. He's like, yeah, it was so clean in there. It was unbelievable.
Yeah.
So, she's got standards to
You
uphold.
could have a picnic in there. It's so
That's
clean.
right.
It was so clean. So that's the goal again. You know, I've got to set a standard.
Right.
So today, just pretty much all liquids and pretty much clear liquids for the most part. And
Did you poop any more today?
I did not.
Okay.
I did not until tonight.
What are you gonna do
Because I drank
tonight?
another bottle of magnesium
You did
citrate.
not.
I did.
2 bottles in a row?
That's right. I did another bottle of magnesium
So
citrate.
you're not going to sleep tonight either.
Well, actually, it's already started having its way, having its way with
I'm
me.
surprised you're sitting here doing this podcast right now.
Well, if I have to run, you'll understand. Have to run, you'll understand.
Crazy.
So I'm doing that.
Crazy.
Yeah, and then tomorrow will be clears all day until I'm done doing my procedures, and then I will.
Come home and pass out.
Well, I was thinking of doing yoga,
Oh my
but
goodness.
maybe not. And I'll come home and I'll start my prep. The actual prep. The actual prep.
You're a crazy woman.
And I am already thinking about what I'm going to eat.
What are you going to
Yes.
eat?
Yeah, so...
Well, I made you that pudding and that Jell-O, but it doesn't look very appetizing.
Oh, no. I'm talking about when I'm done with my
when
procedures.
you're done with the procedure.
And when you take me.
Oh,
and
am I
when
taking you again? I know. Last time we went for breakfast.
Yeah, that's right. We went for breakfast. I ordered like 2 breakfasts.
I think you ordered 1 of everything on the left and 2 of everything on the right. Last time we went.
Yeah.
Yeah, so where are we going for breakfast?
Yeah, we're going to the same place, man.
Oh,
This is
yeah?
going to become a tradition.
Okay.
Yeah,
All right, very
Biscuits
good.
Cafe.
Biscuits Cafe.
That's
Here we
right.
come.
Biscuits Cafe.
All right.
That's right. So
I might need to prep. Get ready for that.
that's So look, it is so important for you to get your colonoscopy done. And I know that we just recently did a podcast on colonoscopy. Actually, we did it during March because it was Colon Cancer Awareness Month. And but I can't emphasize how important it is. And the guidelines now have changed. It used to be that 50 was the age for starting. You know, if you had no high risks, like family history of colon cancer in your mom or dad or a sibling, the starting age was 50, but now it is 45. Okay, 45. And yes, 45. 45. Tina.
That's because people are eating such bad diets. They're getting colon cancer sooner. That's the reality.
Yeah, it is. I'm telling you, I'm finding polyps on really young people.
Yeah.
Young people, patients, you know, people in their 20s and 30s. And I'm finding polyps, and these polyps are coming back as precancerous. So, you know, it's just amazing the stuff that we're seeing. But if you are 45 and haven't had a colonoscopy, please get your colonoscopy done. Colon cancer is one of the most preventable cancers. And so there's no reason why anyone should be getting diagnosed with colon cancer.
Talk a little bit about Cologuard Because we had another friend.
Oh yeah.
We
Let's
had another
talk.
friend
That's a
bring
great.
it up this weekend,
Yes,
and
yes.
every time I hear Cologuard, I just want to shake my head. And
So Cologuard, yeah, that actually, I'm glad you brought that up. Cologuard is a stool test that's available.
and a lot of doctors, especially GIs, are using it as a way of not doing colonoscopies.
No. Primary care docs.
Oh, okay.
The primary care docs are using it to try to like save, their patient from, having to have a colonoscopy. And so, and of course, that patient then, that doctor is their best friend because they're not making them go have a colonoscopy. So the Cologuard test for DNA and also picks up blood too, but it's basically to detect any abnormal DNA. And if it picks it up, if it's positive, then the next step is to do a colonoscopy because the concern is that could be maybe from a tumor or polyps. I mean, I think maybe I've had one case where they ended up having a tumor. Okay, of all the positive Cologuards that I have seen and done colonoscopies on, I think only one. And the rest of them, they had like hemorrhoids, polyps, but other than that, I mean, but the thing is that it could, in my opinion, it could give you a false sense of security.
I mean, even if the test comes back negative, it doesn't mean you don't have polyps.
Exactly. I mean, it's a random sample of stool. So what if that particular stool sample doesn't have any abnormal DNA or blood in it? Does that mean that there's nothing? No, it doesn't. And so I just really cringe when I hear, especially people that are, 45 or in their 50s or young and they're having this Cologuard and it comes back negative. And so they're like, okay, I'm good, for a few more years. I'm telling you, you could still have polyps growing in there. Okay. And the polyps are the ones that over time will grow. And for the most part, polyps do grow slowly. I suppose you could have one that's very aggressive. But for the most part, they do grow slowly. But they will grow. They will grow and over time become a cancer, a tumor, a mass. So
that's the whole point of the colonoscopy.
It is.
Is to get those out of there.
The colonoscopy is still the gold standard. Okay, that means it's still considered the number one. The gold standard for colon cancer screening. All right. I mean, we're in there, we're looking with the camera, we can find polyps. If we find them, we take them off, so it is still considered the gold standard. So if you have not had your colonoscopy and you are of age, or if you have family history of colon cancer, especially in a first degree relative, like a sibling or a parent, please get in. Please go see your gastroenterologist or, come see us and get in and do your colonoscopy. It's, again, I will say colon cancer is one of the most preventable cancers. We have a wonderful way to do this preventive study, colonoscopy. And so there's no reason why anyone should be diagnosed with colon cancer.
Yeah, absolutely.
All right. So on that note, I'm going to go.
Restroom.
Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.